I've always had an interest in the relationship between physical activity and mental health in my research, because I think it's an important relationship for two reasons. One, are the consequences of physical activity for mental health, that being physically active has positive mental health benefits, but also mental health can act as an antecedent of physical activity behavior. Perhaps we need to be mentally well in order to engage in physical activity. So a lot of my research has been interested in that bi-directional relationship between physical activity and mental health. And I first started off doing research, working in mental health services and developing physical activity interventions for individuals with serious mental illness. And that's led to the project that we're talking about today in developing a training module to develop the skills of exercise professionals to work in those mental health settings. The impetus for the module came from changes in the clinical guidelines for the treatment of depression in Canada. In 2016, the Canadian Network for Mood and Anxiety Treatments came up with new guidelines that also endorses exercise as a frontline monotherapy, a treatment in itself for depression. And again, my research has started to take a bit more of a turn to looking at implementation. How do you implement these new clinical guidelines? And at one end, we need to think about the exercise professionals. Who delivers these exercise interventions for individuals with depression and perhaps other mental health problems? And so that was the stimulus for creating this course of looking at ways in which we can help exercise professionals develop their competencies and their confidence to work with clients with depression. And so the course is also relevant to any exercise professional in promoting mental health literacy. And mental health literacy is the knowledge, the beliefs, the capabilities that enable the recognition, management, and prevention of mental health problems and the reduction of stigma associated with mental illness. So I think that's one of the key outcomes that we see for exercise professionals from this module is developing mental health literacy. Well, we saw a gap really out there for exercise professionals in Canada in particular. That again, with the new CANMAT guidelines for depression recommending exercise, that we didn't feel that there was enough training or access to training for exercise professionals that would help them engage with clients with depression. So again, that was a real stimulus for creating this new resource. And I think what makes it different is its focus on mental health literacy. And we've tried to create an interactive and engaging self-guided course that can be done anywhere at any time. And for CSET members, it also builds on other training and workshops that they may have done. Well, I think the evidence base is certainly very mature that demonstrates that exercise is one of the best things that any one of us can do for our mental health. But in order to help people engage in exercise, it does require skill and does require the competencies of exercise professionals to help individuals start and maintain physical activity. And we know that mental health problems are very prevalent. At any one time, perhaps 1 in 4 Canadians have a mental illness. And so exercise professionals in their practice are undoubtedly going to be engaging with individuals who are at risk or have mental health difficulties. So having the skills and competencies to help individuals is really important at this moment in time, particularly in the context of COVID-19, where we know that stress is increasing and we've been challenged in our everyday habits of engaging in exercise and physical activity. So I really much see exercise professionals as not just being physical health professionals, but exercise professionals are also mental health professionals, and they have an important role to play in supporting the public and engaging in healthy physical activity. Well, there's certainly evidence that individuals are exercising less, that physical activity levels have, in some cases, decreased. In other cases, it actually has, people have been able to maintain their levels of physical activity. But we certainly know that mental health has been challenged during this pandemic, and so physical activity again is one of those strategies that anyone can engage in. So when we talk about physical activity and exercise as a treatment for depression, one of the reasons why we consider exercise is some of its advantages of there are no side effects. It's good for your physical health, but it's also accessible. Sometimes it can be challenging to access therapy, for example, or it takes time to access antidepressant medication. But physical activity and exercise is something that can be done right now. But again, I think it needs support, and that's where CSEP exercise professionals have a role to play in that. Yeah, so this process took time. It was funded by the Canadian Institutes of Health Research. And what we wanted to create was an evidence-based resource. So we first started working with a postdoctoral fellow, Dr. Madeline Gierk, in doing some scoping reviews, looking at the research already existing, particularly regarding what kind of content should we deliver to exercise professionals. We then engaged stakeholders to an expert panel of stakeholders representing different disciplines in mental health and exercise, and including individuals with lived experience of depression, to help look at what we'd found during the scoping review of the literature and really kind of identify and reach consensus on what was the important information to deliver in the package. We then work with learning IT professionals to develop that interactive, engaging material that you now see before you. And so, that process took some time, but we're really happy with the final product and how it looks.